So we're going to be taking a look at the sexually transmitted disease gonorrhea today. STDs are very common, which is why it's very important that we know about them, diagnose them, treat them, prevent them. And gonorrhea is also one of the very common STDs. It's caused by the Neisseria gonorrhea gram-negative Diplococcus bacterium. It causes the gonorrhea infection. Roman physician Claudius Galen named it gonorrhea because he thought it was from sperm, and the gonorrhea in Greek means flow of seed. The gonorrhea infection in young women are more likely to be asymptomatic, therefore many cases go unreported or undiagnosed, and so this just aids in the spread of this pathogen, so making it more common and more difficult to diagnose, detect, that kind of thing. It's common both in affects both men and women, causing various inflammatory conditions, and it does have long-term consequences. So we've had an influx in cases in Maine over the last few years. Nationally, in the United States, it's the second most common reported notifiable disease through the CDC. It does occur only in humans. It's most commonly in adolescents, especially those who participate in sexually at-risk behaviors. It increases, of course, with the certain activities and frequency like unprotected sex, multiple sex partners. Women have actually a 50% chance of becoming infected with a single sexual encounter with an infected man, men only having about 20% of infection during a single encounter with an infected woman, so according to our textbook. And those who are at risk, again, are the teens and young adults. That's the group that we're going to be looking at the most. High risk are to girls under the age of 25 due to their sexual practices. Frequency does increase the risk, and again, women are usually asymptomatic, or can be more common, so that's the age group that is most at risk. The symptoms, men tend to have more presentable symptoms. They have painful urination and the pus-filled discharge. Women, of course, being asymptomatic, according to our textbook, about 50 to 80% of women who have no symptoms or no obvious sign of infection, and this can go on for years. So, but when there are signs and symptoms, purulent during discharge or painful burning sensation during urination, it does occur both in men and women, and that's because the urethral opening is so close to the vaginal opening, so it can easily go into the female urethra. And then with the vaginal speculum exam, it's common to see discharge and inflammation of the cervix. And especially because the infection can ascend, and so women will often complain of the first sign being cervical motion tenderness, and so that's described as like painful intercourse, or upon examination, it'll be more tender and less tolerable. So this is a pretty robust bacteria. It's smart, it's resilient, and it's ever evolving, so it keeps us on our toes. So Neisseria gonorrhoeae usually forms pairs of cells that have fimbriae. These are the little attachment appendages. It also has the polysaccharide capsule, major cell wall antigen, which is composed of the lipid A endotoxin and sugar molecules. So for reference, cells that don't have these three characteristics are avirulent, which speaks to the potency of this bacteria. It also can protect itself from our immune system by secreting a protease enzyme, which breaks down the IgA. It will invade by adhering to our epithelial cells of our mucous membranes lining the genital, urinary, and digestive tracts. So that's with the regular vaginal intercourse, or anal and oral. So all three, actually. The mode of transmission being sexual, and of course, with any STD bacteria, they don't like to survive, or they can't really survive on dry, cool, inanimate objects. They prefer the warm, moist mucosal membranes. The other thing about this is that just a few, as 100 pairs of cells can cause the disease, so not much needs to transfer from one host to another before it becomes pathogenic. It's most commonly infects the cervix for women. But it can attach to sperm cells and actually hitchhike to the uterine tubes and beyond, which is when you'll start seeing the pelvic inflammatory diseases. Chronic infections will lead to scarring, and that's when we'll see the infertility, sterility, and ectopic pregnancy. So that's the biggest concern. So again, like I said before, they'll be asymptomatic, have it for years, will build up the scarring, and then have the fertility issues and just long-term discomfort. So it's the importance of early detection and treatment. The interesting thing about this bacterium that I actually discovered was when our immune system does detect it and starts fighting off, once it's phagocytized, it actually can survive and multiply within the neutrophils. So that's when it again hitchhikes with these little white blood cells and traveling through the body. So this is rare, but it is possible. It will travel to joints, meninges, and the heart. So that causes the arthritis, meningitis, and endocarditis. So that's another big concern about this pathogen. Babies delivered vaginally from an infected mother can be infected through their eyes. And so that will cause this inflammation of the cornea, leading to blindness. So that's why with prenatal care, we'll screen for gonorrhea and then give treatment prior to birth. And regardless of the results of this screening, once a baby is born vaginally, we will apply the azithromycin ointment to the eyes. So treatment for this is obviously antibiotic therapy, which will treat the infection. It doesn't undo any of the permanent damage that's caused by this bacteria, and it actually is becoming harder to treat because of this drug-resistant strands of gonorrhea that we're starting to see increase of over the years since about in the 1980s. Actually, according to the CDC, it started in the 1980s. The resistance to penicillin and tetracycline emerged. Those were the two antibiotics that were originally used to treat this. It's actually no longer recommended because of the widespread resistance. They then switched in the 1990s they switched to the fluoroquinolones antibiotics, and then in the 1990s, that's when again the resistance appeared and progressed widespread to 2007. The CDC finally no longer recommended that for treatment, and now the only class that remains effective is the cephalosporin antibiotics. That's and I can never pronounce this right, cefixime and the ceftriaxone antibiotics, so those two. In 2010, the CDC took additional measures to combat this progressive resistance to try to stay ahead of it. By recommending a dual treatment of azithromycin and the injection of the ceftriaxone. And this was in part due to when they saw this trend of the emerging resistance over the years, they track these cases. There's actually several projects out with the World Health Organization and with the CDC on tracking these gonorrhea cases and looking for resistance. They started seeing resistance with the cefixime, so that's why they said, nope, let's not go with that. We'll just do the azithromycin and the injection of the ceftriaxone. So that's what remains now the recommended treatment. But again, the untreatable gonorrhea does loom in our future, and many microbiologists and researchers have tried to stay ahead and continue to do so. But I think we probably will see an untreatable gonorrhea unless more antibiotics are developed, or we can really put a stop to this. And which leads me to the STDs that are preventable for vaccines. So we do have vaccine preventable STDs. There's 3 of them. They're HPV, that's the human papilloma virus, and this vaccine will prevent cervical cancer. That's what this virus does cause. Both the CDC and U.S. Food Drug Administration does deem it safe. The most common side effects is the injection site reaction and sometimes fainting. So the injection site reaction is actually just this localized redness, inflammation, tenderness at the injection site, which is in the upper arm. The fainting is not common but frequent, so the CDC does recommend family physicians and pediatricians to hold their patients for monitoring about 15 minutes after they get their vaccines, just for safety, so they don't have any secondary injuries from fainting. Other than that, it's pretty safe, and clearly the benefits outweigh that risk. The CDC reports within 6 years of the introduction of this vaccine, there was a 64% decrease in HPV prevalence among the females ages 14 to 19. Again, that's that age group. And 34% decrease among those aged 20 to 24. So it was good response. Hep A is the second. Hepatitis A, it causes liver disease, and the most common side effect, again, is that injection site reaction. According to the CDC, clinical trials have shown that the vaccine is effective in preventing infection in about 95% of people who are exposed. So safe, effective, the benefits far outweigh the risks. Hep B, the rate of new hepatitis B infections have declined by approximately 82% since 1991, when they made this a routine vaccine for children, which they have said is a greater than 90% protection once the series is completed. So this is really good because hepatitis B will cause liver inflammation and damage, over time scarring it, which then progresses to liver cancer. So not only does the HPV and Hep B prevent these STDs, it prevents the long-term consequences of cancer. So it's kind of twofold, which just adds to the benefits of it, and again, pretty low risk. And that is it for today. My references, obviously, I've listed right here. American Sexual Health Association, Center for Disease Control, World Health Organization, our microbiology textbook, and the Lippincott Manual of Nursing and Understanding Pathophysiology. I don't know how to pause it. Oh boy.